never talked to him about my diet. And I developed sleep apnea, so I had a sleep doctor, and that triggered a irregular heart rhythm, so I had a heart doctor, had high cholesterol, so I had interns. And they just kept giving me stuff. And, you know, CPAP machine, pills, and on and on. And then one day I was laying on the couch and saw Forks Over Knives. And, you know, for the first time, the idea that food could be medicine, it was, you know, it's such a simple concept, but it had never really occurred to me. I was so kind of disconnected. You know, food was food, and, you know, heart disease was heart disease, and high blood pressure was high blood pressure, and I was taught how to treat those things. So literally overnight, I thought, you know, I'm going to give this a try. It would really be unconscionable not to do this for a few months and see what happens. And lo and behold, 3 months later, I'd lost 30, 40 pounds. My cholesterol went from 260 to 150. Sleep apnea away, you know, AFib went away. So that's when I realized that, you know, I thought I had been this great healthcare practitioner, but I had not been practicing healthcare. I've been practicing sick care, where we wait for people to get sick before we treat them. You know, your blood pressure's high, here's some pills, they work great, but now your cholesterol's higher, so here's some more pills, and now you just delayed the stent, and now you've got cancer, so here's some chemo, and now you have Alzheimer's, you really run out of stuff to do now, so you just have to go to a nursing home. And that's what we call healthcare, but it's not. You know, we add years to your life, but we take away life from your years at every step of the way. And the only way you can practice true healthcare is focus on the root cause, because every one of those diseases, the root cause is exactly the same. It's the food we put in our mouth, how much exercise we get, how we cope with stress, and the environmental toxins we expose ourselves to, primarily through tobacco and alcohol. So that was the start of my journey about 5 or 6 years ago. Went on to lose about 60 pounds total, and now run marathons and triathlons and all kinds of stuff. It's been pretty amazing.
So we had you on the Examiner podcast. This whole story is amazing. And I also find it amazing that you, being a doctor, went through all that, having all of these other doctors being on all these pills, the CPAP machine, that just blows my mind. But Dr. Sugarbaker, I want to ask you, when did you start to incorporate food as medicine into your practice?
I would say, like Dr. Loomis, the root of it was when I was coping with a personal medical crisis, so to speak. And I was looking for answers everywhere. And being a physician, I was searching the internet, as we all do, and looking for answers, because none of my physicians were giving me the answers that would help me. And I ended up at a nutritionist's office who recommended doing elimination. So I had been vegetarian at that point for over 20 years, but I had never thought about the vegan aspect. So, you know, the first step in working with her was, let's try 2 weeks with no dairy, 2 weeks with no eggs, you know, do it all at once, and then put back one after another. So essentially what happened was, you know, the first 2 weeks I eliminated dairy and eggs, and, you know, I was already vegetarian, so I wasn't having other animal products. And then I found out, I said, well, wow, I feel great. I feel so much energy, my skin has cleared up, I'm sleeping better, my allergies are better. So then I started thinking, well, what about for my patients? Why don't I recommend this kind of thing? It's easy enough to do, it doesn't cost anything, and it's going to work pretty much. So I started trying. So my first patient, I'm a family physician, so I see children and adults, and my first patient was a family where the child had gotten repeated ear infections over and over and over, like a 1-year-old child. And I said, well, why don't we try eliminating dairy? And it was like just a look of shock on the mother's face. Like, what did you say? No milk for my child? My child just turned 1. You know, what will I do? And we tried it for a month or two, and she said, wow, you know, he's sleeping better, he's calmed down, no ear infections yet. I said, okay, well, let's follow up in a couple months. And then it was just better and better. He was just doing better, no more ear infections after that point. His allergies had gone away. So it was just such a tremendous result for such a small intervention.
And Dr. Porras, I would imagine that in your practice as well, you've encountered a great deal of skepticism. So when a patient or a patient's family member comes into your office and you start telling them the health benefits of eating a vegan diet, how do you deal with that?
Good evening, everyone. Thanks for being here tonight and for PCRM to invite me here. Yeah, I mean, I think that the main issue that I find in terms of nutrition is milk. The recommendation for cow's milk in childhood. We in one way or another can be tied up to the consumption of cow's milk. And so, yeah, I mean, I think that skepticism is something that's extremely common, and you know, I don't have you know, I'm lucky that I don't see patients with heart attacks or diabetes type 2, or, you know, breast, prostate cancer, things like that. But so what I see have been really, you know, a large number of small improvements that have ranged from improved eczema, which is a common skin condition that can present with, you know, it's extremely bothersome for the child, with extreme itchiness, poor sleep, and we know that about a third, between 30 and 40% of kids who have eczema, this chronic condition, food allergy is the main trigger. Dairy being by far the most common one. Constipation is another big one. The cause of constipation in kids can be, depending on the age, can be due to a wide range of factors, but especially the younger ones between 1 and 2 or 3 years before toilet training develops, cow's milk protein is a big trigger. Acne, I've seen a few patients that, you know, have incorporated not only eliminating dairy but also decreasing the intake of simple sugar, refined sugar, and that has been good. You know, I've seen good results. And yeah, I mean, I think I especially this last year after this documentary, What the Health, I feel like I've seen more interest in patients every single week. I see at least 1 or 2 families that are expressing interest in this way of eating, and that is very encouraging, because that's the way that you know, I feel like we can make a bigger impact other than just prescribing medications.
And Dr. Loomis, we've talked now about the skepticism among patients and their families, but what about when you're talking to other physicians about the health benefits of that vegan diet? What kind of pushback do you get there, and how do you overcome that?
Well, I think that's a significant problem still. And I think there's a lot of reasons for that. First of all, you know, we're really not taught anything about lifestyle and nutrition in medical school. So everything we learn is really based in this kind of treatment paradigm around drugs and such, because that's what, you know, we like to practice evidence-based medicine and use scientific studies to drive our decisions. And, you know, much of the evidence around the treatment of chronic disease is around pharmaceutical treatment. And, you know, who funds those studies? Well, it's not, there's no big kale out there that's going to fund the study about using kale to treat diabetes. So, you know, from early on in our training, we start to kind of get this, you know, it's scripted to use medications. And the payment system, you know, it takes a lot of time to counsel patients on changing their lifestyle. And, you know, the way insurance companies work, and, you know, we're paid piecework. You know, you get 7 minutes with the patient, and you got to move to the next one. So that makes it very difficult, because even when physicians do show some interest, trying to incorporate that in day-to-day practice becomes difficult. But the good news is, I think that's changing. There's an International Plant-Based Healthcare Nutrition Conference, which has been going on for, this will be the 6th year coming up. I went to the first one, and there was 200 people there. This last fall, there was over 1,000. You've seen attendance at our conference, the International Nutrition and Medicine Conference that PCRM sponsors here in DC. We've seen attendance double, almost triple over the past few years. Membership in the American College of Lifestyle Medicine has almost quadrupled in the last few years. So I think more and more physicians are starting to understand the importance of lifestyle and starting to incorporate it into their practice.
And Dr. Sugarbaker, real quick before we open it up for questions, I just wanted to ask you if there's any one particular tip that you could share with people in the audience tonight. What would that be? A practical nutrition tip.
I usually start with patients and I say, start small. So many times I have patients start with 1 meal per week being without meat, without animal products. And for a lot of the patients that I see, we have a very diverse family medicine practice, very diverse ages, and men, women, and also socioeconomic. So that's a real struggle. People people don't know how to eat meals without meat. And I say, we'll start small, and here are some resources, here are some ideas, here are some ideas, like if they would like to start with dinner, here are some ideas that I use. And I think when a doctor or other healthcare professional speaks to a patient like that, if this is something that I've struggled with, I've gone through, and these have worked for me, I think that really resonates.
Outstanding. We have time for about 2 questions in the audience. Does anybody have a question for the panel? Show of hands. Right down here, sir. I'm coming to you. Stand by. All right, so we're standing right over here. We're worried about feedback. So what is your name and what is your question?
Michael Coleman. My question is, I have a general practitioner. He's okay. Twice a year he'll tell me, take my fish pills. No, I'm not going to do that. How can I'm in Annapolis. How can I find a vegan-friendly doctor?
So there's a couple of websites now, plantbaseddoctor.org, and you can search. So Plant Nutrition Project has a website, and there's another one. Veg Doctor. Yeah, there's 2 or 3 now. If you just Google plant-based doctor directory, it will give you a list of practitioners who have self-identified as being plant-based friendly, and that's a fabulous resource. And that I know for a fact that database is growing every day.
Okay, I think that we have one more question over here, so I'm coming to you. If you could meet me kind of halfway there in the aisle, that would be wonderful. And same question, what is your name and what is your question?
My name is Mike, and your points about vegan diet are well taken, but the one thing that I would like to hear more about is I've seen plenty of vegans that are unhealthy simply because of the type of vegan food they eat. And I'm wondering why there is not more of a distinction drawn between healthy vegan food and non-healthy vegan food, such as GMOs and glyphosate and all these chemicals that go into these products. Shouldn't we be stressing organic vegan food?
Dr. Sugarbaker, Dr. Porras, you want to field that one?
Sure, yeah, I mean, I think that there's many reasons why people decide to adopt this vegan diet, and our interest is mostly focused on health. In my practice, for example, I see many teens that they come to me, and parents are concerned because their kids they want to stop eating meat because of environmental or ethical issues, and then they just focus on what not to eat, but not on the things that they should be eating. And so I think that's why I don't think that's why again the term vegan is very wide. And I think we're in the same page that we promote the whole plant based diet, right? And vegetable oils, Oreo sodas, they're vegan products, and they're not going to enhance your life. I personally, I grew up vegetarian, thinking that I was eating healthy, and about 5-6 years ago, became more conscious on this way of eating. Forks over knives seemed to be too good to be true to me, and I got deeper into the research and started experimenting with myself, and and was able to really find the full benefit by noticing weight loss, decreased blood pressure, and cholesterol, clearer skin, more energy, and so on. I think if we there's so many things that we can focus on: organic, non-organic, GMOs, and I think if that can water down, I think the message, and I think we focus on eating more and the 4 big groups of foods: fruits, vegetables, whole grains, beans, and lentils, and the rest is just really just fine tuning the diet. That fits.
Shouldn't you be stressing this organic as opposed to organic?
I think if organic is going to limit your access to fruits and vegetables, that's probably not my main focus. It's not going to be. Yeah.
Okay, Dr. Lewis, Dr. Sugarbaker, Dr. Porras, thank you very much. Round of applause. is the microphone on the chair every time.